Alex Earl. We're here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. So this is the time I get to spend with you guys, and of course answer a lot of your plastic surgery questions. Okay, and so today what we're going to do, we're going to go over a very important topic here regarding what you need to do before surgery. Okay. And then after that, of course, I'll be able to take any questions that you may have regarding any plastic surgery topic or any procedure. All right. And so I want to start off by saying I have a little bit of good news and a little bit of bad news. Okay. So let's start with the good news. All right. So the good news is we have a couple of open spots for August, all right? So very, very limited. We have a couple open spots there that just opened up. So if you guys don't want to wait till December or January, you should try to kind of hop on that real quick, okay? Now, in order to do that, though, you have to be prepared, right? So we got to make sure we have all your information and all your clearances, okay? And that takes us to the little bit of bad news. So the reason we have a couple open spots is because a couple of patients have not been able to get their clearances on time, okay? And that is something that we're starting to see a little bit more and more lately, and so that's what I want to discuss here today, because we want to make sure that all of our patients that are coming up that have their dates set already now through end of December, that we're able to, of course, have your surgery on that date and not need to cancel or postpone things, okay? So let's talk a little bit about pre-op and basically what you need to do in order to qualify for surgery so that we can make sure that we're doing the surgery in the safest conditions possible, because at the end of the day, that's what it's all about, right? We want to make sure that the surgery is safe and that you get home back to your family, okay? So starting from like the very beginning, so we do have some general criteria, very broad, very general criteria that need to be met in order to even just be a candidate for surgery, okay? And that mainly falls into three important things. So number one is age, and especially for lipo BBL, for me the age limit is 50 years old, okay? So you have to be 50 or under in order to qualify for pretty much most surgeries that we do, but especially for the lipo BBL, okay? Now I know, I understand it's very rough, and I can also understand that there can be very healthy 50-year-olds and very unhealthy 25-year-olds, okay? I get that. However, you also have to understand that from my point of view, this is a completely elective surgery, okay? And I've done about 3,000 BBLs now. And I found that in my experience, patients over 50 just don't tolerate the surgery as well, okay? We have a lot more issues with low blood pressure, having to go to the hospital for hydration, and all these things, okay? So due to that experience, so the age limit is 50, okay? And similarly for BMI. So once again, I understand BMI is a very crude type measurement, and there can be someone that's fairly muscular and very healthy with a BMI of 30 or above. But in general, anyone who has a BMI that is above 30 is at higher risk for complications, okay? And this is not just me saying it. There are multiple studies that demonstrate this. So, what are the risks? Risk for blood clots and DVTs starts to go way up after the BMI is 30. Risk for respiratory issues or complications after general anesthesia, it starts to go way up with BMIs higher than 30. Okay, so again, for your safety, the max BMI is going to be 30. So you got your BMI has to be 30 or below. And then of course you have to be generally healthy. Okay, so that means either no medical conditions at all, or if you have certain medical conditions that we do accept, that those medical conditions are under control. So what are some examples? What are some examples of medical conditions that are still accepted, but of course as long as they're under control? So diabetes is one, high blood pressure is another, thyroid issues, hypothyroid is another. So of course, if you have any of those, you can move forward and have surgery, but we have to make sure that everything's under control, that you're on the correct medications, that all the levels are within normal limits, and that you have clearance from the the doctors that you need, whether it's just a medical clearance or you need something more specific like an endocrine clinic clearance, for example, or a cardiology clearance or something like that. Okay. All right. So that's just in general. That's just kind of to get through the gate. Okay. Once you get through the gate, then the next thing that's going to happen once you book surgery and you have a date, you're going to be getting a call from our pre-op department. And this call is very, very important, okay? Now, whereas before, we were doing this call perhaps about 30 days before surgery, now, due to certain issues that I'm going to talk about here, we're going to start doing this call 60 days before surgery, okay? So anywhere between 45 to 60 days before surgery. And the reason is that we need you to do a lot of stuff before your surgery day. We've got to make sure that you have enough time to get all that accomplished, okay? So what is some of this stuff that you have to do, all right? So labs are very, very, very important. So we are going to ask you to get certain blood work, okay? And this includes the CBC. So the CBC is the one that tells you about your blood count, okay? And of course we need your white blood cell count to be within normal limits, and we need your hemo level, your hemoglobin, to be ideally 12 or above, although we do accept sometimes above 11 as long as we're able to use the cell saver, okay? But ideally you want that hemoglobin level to be 12 or above. And then we're going to do a CMP. So CMP stands for a complete metabolic profile, and that tells us all about your electrolytes, and all those electrolytes, you know, your sodium, your potassium, your chloride, all those have to be within normal limits, okay? This tells us a lot about your kidney or renal function as well. So if your kidney function is off, those electrolytes tend to be off, as well as, especially two other very important ones that are called the BUN and the creatinine. Those have to be within normal limits because that tells us that your kidneys are functioning well, okay? The next one is what we call your Coax. This tells us how well you clot. And there's two important tests there that sound very, very similar, but they're not the same thing, okay? And one of them is your PT, and the other one is your PTT, okay? Not the same. Those are two separate labs, and we need them both, all right? The PT sometimes is called the INR. So PT, let me write that, so right here. So PT is the same as INR, okay? But PT is not the same as PTT, okay? So we need both those labs to show us how well you clot. If these numbers are too high, that means you have a tendency to bleed, and then of course we shouldn't be doing the surgery, okay? All right, so very, very important there. The next one is your HCG to make sure you're not pregnant, and last is your HIV test to make sure there's no HIV, okay? Now, if you're an HIV patient, can you be a candidate? Yes, you can. Yes, you can, but then we're going to be doing further labs. We're going to make sure that all your CD counts are within normal limits and that your viral load is undetectable, okay? CD counts within normal limits and viral load undetectable. And if you have that and you're taking your medications and you get your medical clearance, then we can move forward, okay? All right. Now I put here more labs if needed. So what if you have thyroid issues? For example, you suffer from Graves' disease or Hashimoto's, have hypothyroidism. Then we have to get a whole thyroid panel as well. Okay, they're going to measure all your thyroid levels, and we want to make sure that those are within normal limits. Okay, what if you're a diabetic? If you're a diabetic, we have to make sure that you're well controlled, and one of the lab tests that we do to do that is called the Hemoglobin A1c. Hemoglobin A1c, and now I know it's a little confusing. That's not the same as your hemo level. It's completely different. All right, but if your hemoglobin A1c needs to be 6.5 or less. All right, so hemoglobin A1c needs to be less than or equal to 6.5 for all type 2 diabetics. If you're a type 1 diabetic, then it can be a little bit higher, up to 7.5. Okay? Hemoglobin A1c 6.5 or less, unless you're a type 1, in which case it can be 7.5 or less. Okay? All right, and then, you know, any other labs that we could potentially need need to be added. All right, and then so everyone's getting these labs here. Everyone's getting an EKG. no matter the age, okay? I know you're 20 years old, you're super healthy, I'm still getting an EKG, okay? Because why not? It's better to be safe than sorry, all right? What if you have, some underlying heart condition that has not been symptomatic, but it can be symptomatic with general anesthesia? Well, that would be a terrible tragedy, right? So we're getting that EKG, all right? And everyone is getting a medical clearance from your primary care doctor. Every single patient. So these labs, this EKG, that medical clearance is for 100% of our patients. Okay? These are all extremely important. And again, we're doing this to make sure that everything, all the boxes are checked and everything is extremely safe in order to undergo general anesthesia. All right? Now, here's the issue that we're having today. And this is why we have those couple open spots in August, and this is why we've moved the pre-op call from 30 days to 45 to 60 days before. And that post-COVID, a lot of patients are having trouble getting in with their primary care doctors and getting their medical clearances. And rather than kind of scheduling people within 2 weeks, they're telling them they gotta wait, some ridiculous amount of time, 2 months, 3 months, whatever it is. And so, and it's very, very important. Every single patient needs to have this. All right. So if you're already planning into having your surgeries over the next few months, here's a very, very important tip that you need to know. Medical clearances are good for 6 months. So you don't have to wait. You don't necessarily have to wait till we call you for that. If you're within a 6-month period, you can go ahead and get your medical clearance, okay? And the EKG is also good for 6 months. So you can get that ahead of time as well. Unfortunately, the one thing that is not good for that long period of time is your labs. Your labs are only going to be good for those 60 days. Okay? So while it may be very, very, since post-COVID it's so difficult to get these medical clearances, it may be a good idea to just go ahead and get that now. And just know that once you get to within 60 days, then you'll be able to just get your labs, but you don't necessarily need an appointment for that. A lot of times the offices can just do it through their secretaries or their nurses or whatnot, okay? So, this is our recommendation. Our recommendation is if you're within 6 months of your surgery, go ahead and start scheduling for that medical clearance. At that time, they can do your EKG, and then just get a lab order, but don't actually do the labs. Okay, get a lab order, and so then once you fall to within 60 days of your surgery, go ahead and execute that lab order and get your labs, okay? And I hope that makes sense. All right, and that way we won't run into these issues with getting appointments, which is, especially hard now post-COVID, okay?
Question really fast on that. I was under the impression that you had to get cleared within 30 days. I didn't know there was a distinction between medical clearance and labs. I thought they were one.
Right, so that's exactly what I'm explaining here, just to clear that up, because you're not the only one. We've had a lot of patients with those questions, okay? So again, just to reiterate, because it's a very important point, and it's something that I think is going to help moving forward, especially with all these problems getting all these appointments, okay? So for your EKG and your medical clearance, those can be good for 6 months. 6 months, okay? That's also important for those patients that are doing 2 stages. So if you're coming for stage 1, say for example your mommy makeover, and then you're coming back for stage 2, your BBL, and it's 3 to 4 months, okay? Then you don't have to repeat your EKG and your medical clearance. The only thing you have to repeat are your labs, okay? But labs need to be within 60 days. That we've just expanded. It used to be within 30 days, you're correct in that. But again, because people are having all these problems, we're going to extend that to 60 days, okay? All right. Hope that makes sense now.
Thank you. One more really along that.
Yep.
How long do you anticipate COVID tests to remain a requirement, or are they?
So they're currently still a requirement now. And the reason is that we still don't know how well someone's going to do after general anesthesia if they have an active COVID infection, okay? So yes, I understand, nobody really cares about COVID anymore. I understand no one's wearing masks, everyone's traveling without masks and the whole thing. I also understand that for the most part, if you get COVID, you're just kind of tolerated at home, and then you don't have to go to the hospital, and the mortality rate is much, much less now. That's fine. But what people need to understand is that if you have an active COVID infection, and on top of that you do 2 to 3 hours in general anesthesia, okay, then that may put you in the hospital, right? Okay, and so that's what we're testing for. So what we want to do is we want to make sure that you don't have an active COVID infection at the time of surgery, in the same way that we wouldn't do surgery if you have the flu, right? Or if you have any other kind of productive cough or anything with a green phlegm and sputum. We're not going to be doing a completely elective surgery at that time. Okay, so please, I understand it's painful, but we still need that COVID test, okay? We need that to be negative for surgery. All right?
Thank you.
All right. Now, like I said, this goes for all patients. However, if you're over 40, then we are going to require a chest x-ray, okay? And if you're having a breast surgery, okay, breast aug, breast lift, breast reduction, mommy makeover, etc. If you're having a breast surgery and you're over 40, then we're going to be asking for a mammogram as well, okay? Mammogram as well. All right. So these are the important things that you have to do. What are the important things that you need to stop? Definitely no smoking, okay? No smoking for 30 days before surgery, no smoking for 30 days after surgery. And actually I should be more specific there, because it's actually no nicotine in whatever form it comes with, whether it's a chewing gum, a patch, a vape, a cigarette, no nicotine for 30 days before surgery up until 30 days after surgery. Very, very important. When you get here for the day of surgery, we are going to be doing urine tests. And the urine tests are going to test for several drugs, okay, which include, for example, cocaine, okay, methamphetamines, things like that, okay, multiple drugs. And then we're going to be also doing a urine test for nicotine, okay, and a urine test for pregnancy. And of course, all those have to be negative. The only one that we are okay with is THC. So if you have positive THC and everything else is negative, no problem, we're good to go. All right? So the other thing you have to stop 30 days before surgery or 30 days after is any medication that's related to the amphetamine family. So these include medications such as Ritalin for ADHD. So a lot of ADHD medications are related to amphetamines. And then also some weight loss medications such as phentermine. Okay, you have to stop that 30 days before surgery as well. Okay, so we can't have any medication in that amphetamine family in your blood system on the day of surgery. Okay?
Thank you.
All right. Now, we are, the other reason why we're starting all this process 60 days before surgery now is that if things come up, in our CRNAs and our anesthetists, they start looking at your paperwork and they require more information. Sometimes they may ask for more labs, but sometimes they may ask for additional clearances. For example, say you have a thyroid issue and we need your endocrinologist to also clear you. So not only just your primary care provider, but also your endocrinologist. Or say, for example, there's something odd in the EKG. It's not quite normal. It's not something that we're going to cancel you immediately, but we need further clarity, and then we're going to ask for a cardiac clearance. Okay? Or say you have a history of seizures in the past. Well, in that case, we're going to need a neurology clearance, okay? So we may ask for further clearances, and again, because of these issues with getting appointments post-COVID, it's best to get started on that whole process early so that we have enough time to get those appointments and so you can get your clearances, all right?
Did you say chest x-ray within 30 or 60 days?
So chest x-ray, actually that's a good question. So chest x-ray is also good for 6 months, okay? And your mammogram, because you're only supposed to do a mammogram once a year, that was actually good for 1 year.
All right, thank you.
Okay, so great question there. All right, so let's go over that real quick. So chest x-ray, good for 6 months. Medical clearance, good for 6 months. EKG, good for 6 months, okay? Mammogram, good for 1 whole year. And your labs within 60 days. Very important. Within 60 days for your labs there. Okay?
So what should we do if we cannot get an appointment with our doctor in time?
Yeah, so we need it, right? You gotta let them know how important it is. That's why we're gonna be giving you more time. That's why we're having this whole discussion here today. And if your primary care doctor can't do it, then we're gonna need it from some primary care doctor. So it can be a primary care doctor, or basically a primary care provider. It can be a primary care nurse practitioner as well. But you need to be able to get a clearance letter from someone who kind of knows your medical history, knows your prior surgical history, and is able to clear you for general anesthetic.
Thank you. If you have hypothyroidism but always treated with PCP only and what if you do not have an endocrinologist?
Right, so we're probably going to require that because we need to make sure that your levels are, so the first thing we're going to do is going to check your levels, and those need to be within normal limits, okay, your T3, T4, TSH, all of, it's called a thyroid panel is what we're going to have you do. So we got to make sure that's within normal limit. We got to make sure that your medication levels are correct, and so we're probably going to need, some sort of endocrinologist to kind of weigh in on all that. Before surgery. Now, and especially for hyperthyroidism, okay, because that's actually when you undergo general anesthesia, the one that is potentially more dangerous is hyperthyroidism as opposed to hypothyroidism. So if your levels are not controlled and you undergo general anesthesia with some of the medications and the gases that we give you, and you're hyperthyroid, you can go into something called a thyroid storm. Thyroid storm is not good. That'll make a patient very, very unstable, leading to potentially hospitalization. So we got to really, really make sure that everything basically is very, very stable before undergoing surgery.
Thank you. And let's see. Do you provide the lab, EKG, and medical clearance forms?
Yes, we do. So you're gonna have when you get that call, which is gonna be approximately now anywhere between we're gonna push it to about 60 days before surgery. You're gonna get, of course, we're gonna go over all of this in detail with you once again. Okay, our pre-op coordinators are gonna go over all of this, and they're gonna send you the forms that are needed for you to fill out, plus the forms that are needed in order for you to get a lot of these exams.
I had surgery in May 2022. Am I able to get a copy of my lab results?
Yeah, I mean, you should be able to get that from either the LabCorp or whatever kind of system you use for your labs. You can get it from your PCP provider. If you had surgery with us, we should have those here in your records as well.
Thank you. Do you check diabetic glucose levels the day of surgery, even if we got our labs done?
So it depends on the type of diabetes and how brittle the diabetic is, right? So typically for most type 2 diabetes, as long as all your labs are okay and your hemoglobin A1c is okay, we're not constantly checking glucose levels unless there's some sort of concern. Now, if you're a type 1 diabetic, okay, insulin dependent diabetic, then those type of patients need to be monitored very, very closely. And those patients, we're checking their glucose levels throughout their surgery and recovery until they're able to go home and start monitoring their glucose levels themselves.
All right, question about brow lift. If I get a brow lift at age 29, is it anti-aging leverage or premature?
A brow lift?
At 29.
Okay, so 29 is actually quite young to get a brow lift, to be honest, especially today now with the advent of Botox. I would say most patients at the age of 29, what I would do rather than brow lift is to start using Botox. We call that baby Botox sometimes, but that does provide maintenance, and it does kind of slow down the aging process. So I do actually highly recommend it. Starting somewhere around 29, 30 or so, you can start with a lower dose Botox, and that's going to kind of maintain everything, and it's going to slow down the aging process. Why is that? So what creates all the wrinkles and everything else is, of course, the action and you're using your muscles on a daily basis. Okay, so when you start the Botox early, you're using that muscle less. okay, and therefore there's going to be less wrinkles as the years go by.
Let's see. Clearance question.
Yeah.
Is your potassium levels important?
Yes, very important. So potassium level definitely needs to be within normal limits. If it's too high or too low, we can't move forward. Sometimes there can be a lab error. So typically the first thing that we say is, okay, your potassium level is off. Why don't we just go ahead and repeat the lab, okay? And then it'll come back, and if that's normal, then we're okay to move forward. Now, if you repeat the lab and it's consistently off, then yes, that needs to be worked up and corrected before surgery.
What about for patients with an IUD in? Can they have surgery?
Yeah, IUD's typically not a problem, whether it's a drug-eluting IUD or not. Most of the IUDs, the medication that they have is progesterone. And remember, we are okay with progesterone. Okay, what shouldn't be in your system is additional estrogens. Okay, so that's why that was one other thing I should have stated. You got to stop any oral contraceptives or any kind of estrogen-based medications. Also, 30 days before surgery to 30 days after surgery.
Beautiful, thank you. Can you do a mommy makeover with brachioplasty at the same time, or does it depend on the BMI?
Well, it depends. I mean, yes, it's going to depend a little bit on the case, right? But it is possible. We call that the trifecta perfecta. Okay.
Trifecta.
And that's when we do your mommy makeover, which is a breast procedure, and your tummy tuck, and then we add the arm lift to that as well.
Thank you. All right, a future patient. I have surgery with you in August.
All right, excellent.
As a type 1 diabetic, what happens if it's high during surgery due to the stress?
Right, so we're going to be monitoring that, throughout, basically. So one of the things, if you're coming on, I assume by now you've done most of this. Okay, you probably had your endocrine clearance. Your endocrine doctor may give us what they call a sliding scale. And so then as we monitor your sugars, if we need to give you insulin, we can do that. So we're prepared to do all that. So we're prepared to monitor the sugars. We're prepared to give insulin if needed. If it's low, we have also some fluid that we can give you called D50. So we're prepared to do everything. We just need to know, just get some guidance from your endocrinologist as to how many units and things like that. Okay? But yeah, we can do whatever needs to be done to make sure that your sugar stays within an acceptable range during and after surgery.
When is it safe to have lipo and breast lift after giving birth?
So if you're gonna combine that procedure, remember that like here in Florida, when we do a breast lift, we're limited to only 1,000 cc's of fat removal via liposuction at that time. There are some patients that do qualify. That's kind of our famous Miami makeover, when we typically do liposuction to the abdomen and flanks, and then we can do a breast lift plus minus implants, okay? And that's typically for our lower BMI patients. Now, in order to do this after giving birth, you're going to have to wait a minimum of 6 months. But because we are doing a breast surgery, you're going to have to wait a minimum of 6 months after, this is the key, after you stop breastfeeding. Okay? So if you didn't breastfeed at all, then the total time would be 6 months. But if you breastfeed for 6 months and then stop, you're going to have to wait another 6 months, okay, until you have your surgery.
Thank you. All right, we're getting to that time, so just a few more questions for you. Just
all right.
Let me hold you back.
Time has flown by.
Yeah. Let me get, there's plenty, many. All right, so this is another clearance specific. I had a VP shunt put into my head.
Ooh,
Can I still qualify for a tummy tuck?
No, unfortunately. All right. So the way that the VP shunt works is that there's literally a tube connected, from the brain to the abdomen. Okay. And what it does is it takes some of that fluid, that cerebrospinal fluid that tends to overaccumulate, and it brings it down into the peritoneum, which is like inside the abdominal cavity, and that's how it prevents from that pressure building up. Okay. And so when we're doing a tummy tuck, we're in that area, right? We're dissecting all along there, and it would be a terrible, terrible kind of mistake to make to injure that VP shunt during your tummy tuck, and we definitely don't want to risk that. So yeah, we're not gonna, we don't want to create potentially a very bad problem, so we're not going to do that.
Thank you. All right, let's see if I
And
can.
while we think here, the next question, I want to ask you guys a question. You guys can potentially answer. What do you think of the new hat? All right, it's still a Duke hat,
Oh,
but
it's
it's
Duke.
mostly white. So, are you like thumbs up, time to wear a new hat, or you're like, no, just keep the old blue Duke hat?
Well, they didn't even know what it was. So yeah, I didn't know that it was Duke. Yes, it's Duke. Love it.
All right.
Do you only wear Duke?
For scrub caps, I think I've only been wearing Duke scrub hats for the last 4 or 5 years.
No, one more. Look, now you got this started. Hi, Doc. I sent you a scrub cap after my surgery. You never wore it.
Oh no! All right. No,
Maybe it's
I'm gonna dig them all up and wear them for all the lives.
Oh man, no. There's a lot of scrub cap questions. Okay, let's get. All right, I know you got to get out of here. Some clearance. All right, let's see if I can pronounce this. How about thalassemia trait?
Thalassemia, yes.
Thalassemia trait that makes your hemo 10.6.
Right. So at 10.6, you're below the level that we need for lipo360 or BBL. Now, if you're doing something that has very, very minimal blood loss, for example, a breast augmentation, then 10.6 is acceptable. And even for like a straight up tummy tuck, could potentially be okay. Now, what I wouldn't do is a big surgery like a mommy makeover or a lipo360 BBL. For that type of surgery, we need your hemo level to be at an 11, which would be the absolute minimum.
All right, thank you very much.
All right?
Yes.
All right, everybody. All right, well, I hope that clears things up. I hope also that this makes it a little bit easier for everyone to get their clearances on time. So remember, you can do your EKG and medical clearance ahead of time. You can do your chest x-ray ahead of time and your mammogram as well. So that's going to make things a little bit easier now with all these difficult appointments. But your labs, of course, that's still within 60 days, okay? But just a quick reminder then, we do have those couple open spots for August. So if you're able to get this done, let us know and we'll get you right in. Otherwise, we're looking at 2023 for you, okay? All right, everybody. I'll see you all next week on Hump Day with Dr.